Rotator cuff injuries occur in two ways. The most common way is due to degeneration of our tendons as we age. This usually is preceded by a phenomenon called tendinopathy. Because we aren't creating new tendon cells beyond the age of 25, our tendons slowly degrade over time, and the tendon fibers slowly fail as we age. Most patients over the age of 60 who don't have any symptoms in their shoulders, if scanned, can be found to have degenerate rotator cuff tears. So by far and by large, most rotator cuff tears that are degenerate are asymptomatic. But sometimes a minor injury can cause the shoulder to decompensate, and these chronic rotator cuff tears can become painful. The other cause for a rotator cuff tear is a traumatic tear, which can happen due to high-level injuries such as a fall, a shoulder dislocation, car accidents, or sporting activities such as coming off a bike, a snowboard, or quite often skiing. These traumatic tears usually require surgical intervention to repair them to get the patient back to a full level of activity. Rotator cuff injuries are treated depending on whether they are traumatic or degenerate and depending on their size. In traumatic tears, we most commonly offer surgery to try to repair the tendon back onto the bone to get the patient back to a full level of activity. This can often be achieved through keyhole surgery, but this requires quite an extensive rehabilitation period. The patient can be in a sling for several weeks and require up to 6 months of physiotherapy, and it often takes a year to get the shoulder back to normal. If the tear is a degenerate type tear, we may be able to avoid surgery and try rehabilitation to strengthen the other muscles around the shoulder to compensate for the tear which has been there for several years. If we can make the tear asymptomatic, we may be able to avoid surgery. But if symptoms persist despite 3 months of physiotherapy, I often recommend surgical repair. For more severe tears, which may be unrepairable, there are treatment options that are decided on a patient-by-patient basis, which you should discuss with your surgeon. So if you have a rotator cuff problem and you want to have a closer look at that, please get in touch with our practice manager.